Hi, and welcome to your 5-minute coronavirus weekly update for the date of July 3rd, 2020. I'm Dr. Larry Burchett, and alongside Dr. Kathleen Montgomery, we will summarize the science that you need to know for COVID-19. Now, let's begin with the numbers. Last month, 48 out of 50 states reopened. This week, many governors shut it back down. Here's why. Daily new cases in the last 2 weeks in the U.S. have doubled, going from 20,000 to 40,000 new cases daily to 56,000 cases. The percent testing positive, that's this blue line, went from 4.5% up to 7%. That means more people sick with COVID, not just more testing. 38 states are going up, many with record numbers. In early June, for example, in California, we saw about 2,000 daily cases. Now that's way up to 10,000. Florida, similarly, up near 10,000 cases. Texas is not far behind at 8,000 daily new cases. The number of states that remain flat is down to 11, and only New Hampshire and DC have decreasing case numbers. Now, also concerning, some states that were declining previously are now on the upswing, starting to go up case-wise. Illinois, Michigan, Minnesota, and Pennsylvania. Now, while cases are up, there is hope that these new cases are largely young, healthy people who won't end up sick in the ICU. Also, deaths continue to trend down. But don't forget there's a lag between case and death. Hospitalizations are up and ICUs are nearly at capacity, reflecting this. So in the weeks to follow, we will see, can our hospitals handle the surge? That's number one. Number two, will the new science of these treatments of remdesivir, dexamethasone, convalescent plasma, will those save lives? And number three, will the infected young and healthy spread this to those most vulnerable? What about the rest of the world? Worldwide, we added 1.2 million new cases and 33,000 deaths, 30% of all COVID cases in just 3 weeks. There's 5 hotspots: Brazil, India, Russia, Mexico, and the United States of America. Now, these other 4 countries, they're experiencing their first spike. Sadly, what makes us unique in the world is that we've already had our first spike in April, and we're spiking again as the first wave continues to go throughout the U.S. While places like Europe, Japan, and Canada are not experiencing a second spike. Not only do we have more cases, but as you can see in the graph, we have far more cases per million or per capita as well. This is why we must double down on wearing masks. To discuss the evidence and the science behind wearing masks, we turn to Dr. Montgomery.
Thank you, doctor. Now let's talk about masks. One common myth is that masks decrease your oxygen or increase your CO2 levels. This is just plain false. Doctors and nurses wear masks every single day with no harmful effects. I personally wear a mask for hours at a time when conducting autopsies with no ill effects whatsoever. One study compared healthcare workers with and without N95 masks walking on a treadmill for an hour and found no differences in heart rate, respiratory rate, oxygen level, or CO2 level. Can masks reinfect you with bacteria or viruses you're breathing out? Again, this is just not true. There are bacteria and viruses in your nose and mouth, yes, but whatever you're breathing out came from inside your body. If you're shedding the virus in your breath, breathing it back in won't do any harm. Okay, so now that we know masks are safe, how well do they work? We know that coronavirus spreads mostly through respiratory droplets when you breathe, talk, yell, cough, or sneeze. Studies have shown that even homemade masks block these droplets. One found that a simulated cough caused droplets to travel up to 12 feet, but wearing a cotton mask decreased the distance down to only a few inches. Another study found that homemade masks could filter out 80 to 95% of respiratory droplets, especially when made with multiple layers of fabric. Okay, but how do masks fare outside the lab, in the real world? Well, one study found that the growth rate of COVID-19 slowed significantly after mask mandates in 15 states and the District of Columbia. Another study of 198 countries found that cultures and policies supportive of mask wearing predicted lower mortality. Lastly, 4 powerful stories. One singer without a mask infected 52 other people in choir practice. 119 people contracted COVID-19 after one exposure at a bar. But 2 hairstylists with symptoms wearing masks didn't infect a single one of their 140 clients. And an infected, coughing man on a transatlantic flight wore a mask and didn't infect a single other passenger. In short, masks are safe, they work, and they allow us all to get back to work. Please wear them. Back to you, Doctor.
Thank you for watching our 5-minute coronavirus weekly update. Please share this and check out the individual evidence at averpoint.com. For Dr. Kathleen Montgomery, I'm Dr. Larry Burchett, wishing you a very fun and safe 4th of July. We'll see you next week.